You know, these machines are programmed to make the person feel good, are
Correct.
programmed to support you, are programmed. So basically, all about helping you secreting dopamine in your brain, all about secreting serotonin, which is something good and very interesting in terms of healing.
Mhm.
However, it's not human authentic. Why? Because in human interaction and relationship, we
Mhm.
need to get frustrated. We
Okay.
need to get angry. We need to get into a conflict together. Because if I don't go through that with you, how am I going to learn how to manage difficult situation? How am I going to learn how to manage my frustration in life? And life is full of frustration.
Okay. Hello, everyone, and welcome to another episode of the Intelligent Future podcast. In this episode, I chatted with my guest, Dr. Jihene Mrabet, who's an assistant professor of psychology at Amity University Dubai. I chatted with my guest about an important topic, the integration of AI into psychology. AI has been reshaping this field. For instance, we are witnessing the rise of mental health chatbots. These chatbots have been used to treat anxiety, depression. They have also been used to identify diagnosis. And also, recently and very interestingly, these chatbots have been used as companions. They provide companionship and friendship to people. So all of these things can be seen as great success stories for AI, but there is also a negative side to these things. I chatted with my guest about all these topics and more, and we shed light on how us as individuals and society can leverage these advantages, but how we should also be cautious and careful about the dark side of these technologies that are rapidly infiltrating our lives. Now, I'll leave you with the podcast, and I hope that you will enjoy watching it. Okay, Jihan, so you're a psychologist. You've been an assistant professor in psychology and a practitioner in psychology for some time. So tell us from the very beginning, how did you get interested in this field?
With the field of psychology in general.
Correct.
Oh, I think that somehow I was born in it.
Mhm.
Because since I was a child, everyone, my cousin, my friend used to come to me, talk to me about their secret, asking me for advices. So I always felt that I had that kind of drive into helping people, understanding problems, and helping sorting out problems and sort complex situations.
Mhm.
So then when I grew up a bit, I was thinking about being a teacher at the beginning, and I
Mhm.
was about thinking about being a French teacher. But then I was like, because I love French. But then I was like, at a certain level, oh no, and I'm really interested in psychology. I want to do something with that passion of mine, and this is why I decided to go to psychology. There is a small anecdote about it that I would like to share here.
Mhm.
Like, I'm a very stubborn person. So
Mhm.
when I wanted to get into psychology, my father was against it because at that time he was the director of a medical center. Both parents are doctors, right? So they wanted me to follow them and to go into medical studies. I didn't want that.
Mhm.
So he said no. Why? Because at that time he's a very open-minded person, but at that time the ministry sent him a psychologist. That psychologist was a social psychologist, because in psychology we have different disciplines and different specialization.
Mhm.
So a social psychologist in a medical center, poor lady, she was totally lost. She didn't know what to do. So she ended up roaming among offices, literally doing nothing. And my dad had a very high opinion of mine, and he's like, my daughter is not gonna finish her life doing this.
Sure.
And they convinced me somehow to go to something else or to choose another path. So I think my aunt convinced me to go to HR. She said, "Oh, HR is good. Go study economic and whatever, and then specialize in human resources." It's the same thing. Of course, I was a bit naive. I thought it was the case. So I'm like, okay, let me do it. Let me try. I tried my first year, and
Mhm.
I really hated it. It was like so superficial for me. I mean, I didn't like it at all. I love when things are very deep, when there is an analysis of personalities, of
Oh, yeah.
problems, of dealing with issues. It was super plate, like math, finance, microeconomic, macro, microeconomic. It was
It
Chinese for me.
all felt
So
dry to you.
I hated it.
Mhm.
But I was able to do it. So I
Mhm.
sat with myself and I was like, okay, what are you going to do with your life? Are you going to continue in that specific path that you don't like at all? And of course, the question was no. So what are the possibilities for me? So I failed myself on purpose.
Mhm.
I failed myself on the courses. I was not attending the assessment, nothing, doing nothing. And then at the end of the semester, I went to the administration and told them, please give me my mean. I want to know what is my GPA because it was semester wise. So he gave me my GPA. It was out of 20. In Tunis, it's out of 20, and it was,
Mhm.
wait for it, 1.5 out of 20. I mean, I never had that in my life. And I'm a very studious person, right? So I
Sure.
was always among
So
the
that
first
obviously
students.
shows something, obviously. Yeah.
I was like, I took it and I was like so happy. I was like, oh, thank you. And I think the guy was looking at me and he was like, oh, is she in some sort of a shock
Yeah,
or
what's going
something?
on
I
there?
can sense he was afraid, right?
Yeah,
I just
absolutely.
took it and I ran to my mom and I was like, Mom, look, I have very bad grades. I'm not gonna succeed, blah, blah, blah. It's gonna ruin my future. I kind of dramatized it a little bit,
Obviously, with a little
honestly.
bit of crying and so on. Yeah.
No, no, I didn't
No
cry, but I
crying.
was like frustrated. I
Yeah.
couldn't reach that level of drama.
Mhm.
So, so my mom was like, "Oh, sure, sure." So she spoke to my dad, and she's like, "That's not possible. She's failing her studies. She was always a very, very good student, so that's not okay. That's not fine. We need really to help her." And my dad said, "Okay, then you know what? She's gonna go to medical school and enroll in psychiatry."
Okay.
Literally what I didn't want to do at all. And I'm like, okay. And I had to go through some sort of tests and exams
Mhm.
that would decide at the end whether I'll go or not. So again, I failed myself. I was literally answering wrong. I knew the right answer and I was putting the wrong answer. And I was like having so much fun, honestly. And then, of course, I failed. And then mom was like, oh, khalas, it's not possible. We definitely need to enroll her in psychology. She wants psychology. Let's be it. And I still remember that day. She took me with my hand. We went to the university, we went to the director of the university, and she told him, this is my daughter. She want to enroll in psychology. He's like, yeah, definitely show me her grades, her uh, I mean, it was 13 grade for in Tunis, it's 13 grade.
Mhm.
Show me the grade. He looks at the grade and he's like, oh yeah, perfect. We can definitely accept her. I just hope that she wouldn't change her mind. Kind of like, you don't know what did I do to come to this level?
Yeah, because
I already
I mean,
made
I
up
was
my mind.
told exactly. So this is probably another question I wanted to ask you, because you came to psychology from the perspective of wanting to help people, but if you become a student of psychology, there's a lot of theory that could be a bit boring. But you still dealt
Mhm.
with that, and you were happy to go with these studies.
I'll tell you something. Theories in general, we always have that preconception in our mind that theories are boring, which
Mhm.
is not true,
Mhm.
especially in psychology, at least. Let me talk about my
Mhm.
specialization.
Mhm.
Theories are not boring if you try to understand how to make it practical. If you
Mhm.
try to understand the deepest meaning or the deepest analysis out of it. If you stay on the superficie, of course, it might feel very boring. It might feel that you have to rehearse some information again and again and again, just for the sake of sitting for an exam and pass it.
Mhm.
But if you take it as a knowledge that increase or enrich the information you have and the idea or the perception you have about psychological concept, then
Mhm.
it's totally different and it becomes really, really interesting. And
Wonderful.
again, it depends on the professors too, huh? Honestly.
Absolutely, absolutely. Wow, what an amazing story. And then
Yeah.
after you finished your studies, I guess you went for postgraduate studies, or did you practice psychologist in the clinic?
Okay, so right after my bachelor degree, this is also the continuation of my story.
Mhm.
Right after the bachelor degree,
Mhm.
I started working as a part-time psychologist. Guess where?
I mean, in your country of origin, like in Tunisia, or?
Yes, but where? With my father in the
Oh,
medical
wow. Okay.
center.
Oh my God. Okay.
So after I finished, of course, I mean, our bachelor degree is 4 years. So during that time, he kind of delved within psychology. I kind of explained things about psychology. I was all the time on his head
Mhm.
talking about psychology. And as I told you, he's a very open-minded person. So he was discovering psychology through me.
Mhm.
So once I finished, he's like, "Would you like to have a part-time job in the center, just checking patient and whatever?" I was like, "Yeah, sure, definitely." So I did it, and I was super, super happy. I was the proudest ever when my father told me one day. I think it was like I don't know, 6 months probably after I started working with him. He said, "I'm very happy. I'm glad that you're working with me, that you're here in the center, not as my daughter, but as a psychologist,
Oh, nice.
because it really makes me feel the importance of psychology." Why? Because my father is a person that have very good active listening skills.
Mhm.
So every time when patients go to see him, they spend hours and hours talking.
Nice.
So he's enjoying talking, but I mean, basically he's a doctor, so he has
Sure.
to just
At
examine
some
patients.
point, that talk has to stop, and he needs to proceed to the diagnosis.
Exactly. And he's a deeply humanistic person, so he really have always a concern about treatment adherence, about why some patients are not improving, taking some medication, whether actually it should be.
Mhm.
And going through my studies, I kind of opened his eyes about psychosomatic, about the importance of psychology in the treatment process, in accepting the diagnosis. So he was addressing those patients to me,
Nice.
and it really made a tremendous change in the quality of life and quality of medical observance of treatment and improvement also for his patients. So that was just amazing.
Excellent. So
So
you were happy with that. So what made you decide to go for postgraduate studies?
yeah, I never stopped. Even when I went to post to my master's, I
Mhm.
never stopped working.
Mhm.
I
You
started
continued
working
to
right
work in
after
the
my
clinic.
bachelor degree. Yes.
Mhm.
So what I was doing now, it's gonna sound crazy, but it's okay. It's okay. Bear with me.
Sure.
So I was having my master's degree. I had two master, one professional master degree in clinical psychology and psychopathology, and
Mhm.
another master of research later on in clinical psychology. So meanwhile, I was working in the center with my father, as I told you, and also I was teaching. I was a lecturer in 3 universities.
Mhm. Oh, wow. At the same time,
So
in addition to
yeah, yeah, I
working
loved
in
it.
the
And
clinic.
yeah, and that honestly, my first feet into sorry, the light gets off. Am I can you see me
Yeah,
well?
we
It's
can
fine, or
totally
should
see
I
you. No
okay,
worries at
okay.
all. Yeah, you can continue that way.
So I think my first step into teaching is actually because of my professor, Riyad Barjab. He's a very iconic person that really impacted my studies in psychology. He taught me in master, and I think he saw something in me. He saw some potential, and he gave me the opportunity to teach. So he was teaching in a psychiatric hospital. He was
Mhm.
going to the psychiatric hospital, and the students were going there, and he had some sort of a practical course with them.
Mhm.
One day he couldn't go, and he asked me if I could replace him.
Mhm.
And I'm like, seriously? Me replacing you? Seriously? He's
A
a
teacher
professor.
with lots of years of experience.
Yeah,
Yeah.
he's a huge professor. So I was like, okay. I didn't want to say no because I felt that
Trusted
he
you.
really believed in me. Yeah.
Mhm.
And I really felt that I should be at I mean, I should meet his expectation. I should really do well. And I
Mhm.
said, okay, let me do it. And I did it. It was quite weird.
Mhm.
I had, of course, because I was young, yeah. So also being with student in master degree, and those students were student in master degree, so
Mhm.
they were a bit older. So,
Older.
but it was totally fine. It was amazing. I really loved the flow. I really loved the kind of a connection that I had with the students. And starting from there,
Mhm.
it really opened my how can I say, my passion to teaching.
Nice.
So this is why I never really wanted to drop either this or that, nor practice
Wanted to
and
keep both
or
at the same time.
teaching. I really wanted to keep both. So I was busy all the time. I was teaching in universities, having my practice. And then after that, I got engaged in a private practice with two other persons. One of them was an how do we call it? I'm saying it in French, sorry.
You can say it
A
in French.
speech therapist.
Okay, speech therapist.
Orthophonist.
Speech
Yeah, speech
pathologist, I think.
therapist.
Speech pathologist is the term, I think.
Yes. They called also speech therapist and also the psychometricians.
Okay.
So in that office, we had me, a psychologist, and we had speech therapists, and we had psychometricians. They were basically taking care of students or kids suffering from autism spectrum disorder. But there were also some other issues, but they were mainly focusing on that. I had some other type of patients, some other type of issues to handle, but I was also helping them following up with parents of kids suffering from autism, because that is also something very, very heavy to handle for parents.
Absolutely.
So yeah, I mean, since 2008 till 2016, that was my journey.
Wonderful, wonderful. So maybe tell us a little bit about the research you did in your PhD, and then we can move on to other topics in psychology.
My PhD. Okay, so for my PhD, I did research about the role of humor in the adolescence process. And why that topic? I mean, at that time, I'll tell you the context. It was 2013, not 2013, sorry, 2012, I think. And we were just getting out of the Arab Spring. And of course, there were a lot of trauma. People were not feeling good at all. Many students were suffering from PTSD, anxiety, depression. However, even though the country was going through very, very delicate situation, I could still notice the usage of humor everywhere, among teenagers, among kids, in Facebook, in radio stations, in TV. And I was like, oh my God, that's an amazing sign of resilience. I mean, and then I started asking myself, what is the humor doing exactly? Is it just resilience, or is it something different also? And I wanted to target more specifically adolescents. So you might tell me, why adolescents? So I engaged in my research, and it was more about humor, because I love humor, because I think that also it's an amazing way to express yourself. In some sort of it's a way for you to put a distance also with issues, with troubles, and to be able to look at these issues from far away, so you can analyze in a better way.
Also engage the audience, engage the people.
Exactly. And even introspectively with yourself, sometimes, for example, when we say something fun about ourselves, of course, because there are different type of humor, we're not, sometimes we say, for example, oh my God, I'm so stupid. Okay. So if I'm saying it, exactly. If I say, oh my God, I'm so stupid, if I'm saying it, really meaning that I'm stupid, this is a maladapted type of humor. This is not a good one, but it's still humor. But if I'm saying it because I'm just laughing about myself, I'm just realizing that I'm like any other person, and that sometimes I could be stupid, then it makes me feel okay, because I put some distance and I laugh at myself.
Yes.
And laughing at myself also, and laughing in general, it helped me criticize myself, but also criticize others. Criticizing others means also criticizing law. And we cannot develop if we don't mix up, actually, or move a little bit the rules or the standards. Everything is evolving around us. If we keep it as it is, we are never going to be really adapted. So anyway, so I went to that path, and I decided to meet adolescents. I kind of collect their type of humor. I use a questionnaire to collect the type of humor. And out of that, of course, normally there are 4 categories, okay? 2 adapted humor and 2 non-adapted. I discovered a 5th one, which is the adolescents reluctant to humor.
Okay.
Many of my adolescents sample were very much reluctant to humor. They were not really catching it. They didn't really want it. They don't initiate it, and they don't appreciate it. Okay. So
Is that considered a disorder, or is this just a phenomenon you found?
No, at that level, I'm not talking about any
Sure.
disorder. It's
Mhm.
just a fact, something
Mhm.
that I noticed, something that I observed, right? So I end up having 5 categories. Then what happened within each category? I took some of these students, I mean 10% representative of each category, and I let them pass the thematic apperception test, the TAT. So it's a personality test, it's a projective personality test.
Mhm.
And then what I realized is that, of course, we have different analysis of personality depending on each and every category. But what is really, really interesting, more than the slight differences between all the humor category, because once you have that predilection to humor, that somehow protects you in a way or another.
Sure.
But talking about the group that didn't have any, that were reluctant to humor,
Mhm.
actually, this section was
Mhm.
the most vulnerable,
Mhm.
the one that have the most, let's say, percentage to get brainwashed by others, the more to get engaged in dogmatic thinking. They're
Yes.
not flexible. Even when I look at their answer, the answer they give,
Mhm.
it's very much marked by
Mhm.
religion,
Mhm.
but not in a good way.
Yes.
So it's all
In a
about
rigid,
death. It's all
way, in a
about
literal way, in yeah.
exactly. It's all about something bad following them, something bad that will happen to
Got it.
them. They always
Yeah.
talk about fire, about
Yeah.
hell, about devil, so it's all something threatening.
Mhm.
In religion, we don't have only that. We have only
Yeah.
very good aspect that we can look at. So this was something very interesting that I found out with these students ending up having humor and having personality profiles that could be useful for
Mhm.
education purpose, but also for therapeutic purpose. So if, for example, I have a patient in front of me and he's using a certain type of humor, I can tell, oh, that's probably he's having this type of issue narcissistically wise, socially wise. I can
Mhm.
already have my hypothesis ready. Doesn't mean that I'm gonna just
Sure.
use them as they are, but I have already some idea in my mind that I can follow up with during the sessions.
Wow,
Yeah.
what
So that
an
was my PhD.
excellent. What an interesting piece of research. Absolutely awesome. Wonderful.
Thank
So
you.
I want to take you a little bit to a different dive into this discussion, which is what my channel focuses on, which is AI. And as you know, AI
Yes.
has been integrated into so many different things. And surely there is a slice in that pie for psychology. So, as a psychologist, I think recently you have been interested in AI and the intersection of it with psychology, and if you've been engaged with some studies and some research studies that we've been doing together as well. So, tell us a little bit and tell the audience how psychology can benefit from AI. What are some of the applications?
Okay, so first of all, let me tell you that I mean, long time before, if I was ever to mention um, having a psychological session online, they
Mhm.
probably my professor would probably kill me, or probably, I don't know, throw me outside of the windows, like, don't come again. We don't want to see what are you talking about.
Mhm.
So as I told you, psychology or everything in life is about having a structure, right?
Mhm.
But we need to understand that within the development that we're going through, the
Mhm.
structure has to be a bit enlarged. Probably
Mhm.
we need to change it a little bit. I'm not saying that we need to remove the structure at all,
Mhm.
because the structure is very important to protect the patient or the client, whatever you want to call them, and to protect also the therapist. But sometimes a bit of flexibility is not bad also, right?
Mhm. Mhm.
So all happened, or I think all started, that boom about AI and psychology, I think started somehow with the COVID-19 situation.
Mhm. Mhm.
During COVID-19, a lot of person couldn't have access to psychologists. They were confined in their homes. And I mean, people realized that it drove them somehow crazy, right? Many people were suffering from PTSD. They lost a lot of family members, friends. They didn't have the possibility to talk to someone in order for them to process their grieving. Many of them got depressed. Some that had anger issues got a bit more I mean, out of control, because they were not having their regular session with their therapist and counselors and whatever. So I think that somehow everyone, including kids, also were impacted by that situation. And the need for people to reach out to mental health guidance was actually becoming crucial.
Mm-hmm.
What happened later is that need versus reality. So the need was huge, and reality was not able to cover all that needs in terms of quantity and quantity of demands, but also in terms of money, expenses.
Absolutely.
So many people, for example, were not able to afford counseling
Therapy.
sessions or therapy. So they were then, that was that idea of creating some sort of chatbots or some sort of machines that will be able to tackle that point. So there were a lot of chatbots. I think we have Ada, we have Chai, we have MindSpa, Serenity, WeBot. So we have different chatbot actually that help people manage their emotional issues. I'd say in a different manner, right? Sometimes it was really good, sometimes it wasn't that much good. So we will talk also about the benefit versus the disadvantages.
Exactly. I mean,
So
tell us about that, because these things are now on the market, and I'm sure someone
exactly.
listening to us might think, oh, why not? I would like to try one of these. So do they work from a psychologist's point of view, like you, from an expert's point of view? Do these chatbots actually work? They've been designed with solid scientific foundations. Yeah, tell us.
Absolutely. So I'm going to give you some examples. I'm going to give you a general idea and then some examples. So these chatbots proved to be efficient in terms of digital screening and early detection of diseases or psychological disorders. Why? Because it's quite programmable. Right. So, I mean, if you take, for example, the DSM-5, which is the manual of the mental disorders, you can just take it as it is and put it in within the program. And then, halas, I mean, once you put all the symptoms, the program will be able to tell you this is what you might be suffering from. Also, that these chatbots were able to engage in some sort of a conversation. Right. So that was also some sort of a remedy, I'd say temporary remedy against solitude and isolation. Because as I told you, many people were not able to reach out to their therapist whenever they want, to reach out to their friends, families whenever they want. Sometimes if I have insomnia and I wake up at 3 a.m. in the morning and I feel an urge to speak to someone, but I cannot wake up people and talk to them, then I can talk to the machine. And at some point, at some level, the machine is able to give us or to give the person some guidance or let's say some support in terms of listening, in terms of probably giving some advices, giving idea, helping reflecting on what you're feeling, etc., etc. So this chatbot has been proven somehow efficient in terms when it comes to depression, anxiety, self-care, self-esteem. So these are the psychological, let's say, disturbances that these machines were able somehow to help managing.
Okay, so let me ask you a question about that, because this is something I'm interested in. In computer science or human-computer interaction, which is my research field, we have the concept of humans treating machines as social actors. And this has been proven in science that yes, people do. So for instance, they may refer to their vacuum cleaner as buddy, like, a friend, poor buddy, it has been working all day long or something like that. Now with a chatbot, it's much more advanced than a vacuum cleaner because it can talk. So it's faking or emulating the very human thing, which is conversation. But don't you think that if someone is talking to these chatbots, don't they feel deep down that they're not really talking to a living being, they're talking to a machine? So how are they able to engage and this, somehow engage and have this in-depth conversation with this machine, knowing that it's still a machine and it doesn't have feelings and it doesn't have emotions?
So you're taking me to the dark side. Okay, I was still in the
Okay,
pinky one.
sure. Keep going with the positive side, and then we come back to it.
No, it's okay. I'll just alternate. So as I said, it has been proven effective in different area. It helps also outsourcing advices. It helps sometimes in decision making, in adapting a new situation, etc., etc. Now, however, However, this is the problem. So, and this is the core problem when it comes to psychologists, whenever we think about AI and whenever we think about overuse of AI. Because AI itself, I mean, it's not dangerous, right? It's a machine like another. It's a bit more, of course, developed. Okay, very interesting, interacting, as you said, but it's still somehow a machine that is helping human to achieve some task or to achieve some needs. Okay, if we use it correctly in a balanced way, it's just amazing. It's just a way for us probably to get rid of some information or to free up our mind to think about something more important, or to probably delegate some administrative work so that we can free our cognitive capacities to focus on more complex information. So that's amazing. It helps also in guidance. For example, the first research that I did with my colleague here, Mr. Robert, was about checking help guiding freshman students. So these students come to university and many of them do not master English language. And we know that all the courses are in English. So, and we have a lot of them. So we cannot have one advisor per student because the advisors are literally the professors and the professors are busy with their classes, right? And other role. So the idea is that these students were left alone without any possibility to upgrade their English, without any possibility to improve. And we thought about what if we somehow program ChatGPT, we find some activity, and that ChatGPT will be able to help the student, how can I say it, modify their essays and work on writing essays and modify it and give some suggestion so that they learn how to write and what are the most important aspects of an essay, the outline, etc., etc. And we did the experience. It was really amazing because, of course, I added my flavor, psychology flavor, but I wanted to check also whether this kind of guidance, AI guidance or AI tutoring, would be actually reducing the anxiety related task or not. Because the whole, let's say, also objective behind it is to empower the student, to give them, to raise their self-confidence so that during the exam, the final exam or on-table exam, they'll be able to feel less anxious about writing their answers and whatever. So actually this research was amazing because it definitely shows that AI could definitely help the student improving their English essay, their English writing in a very tremendous way. And it is also helping managing the anxiety level.
Beautiful.
However, many students were skeptical, and this is the second part. So many of them were thinking that this is an over-reliance on AI. I don't want a bot or a chatbot to tell me what I should write or I should not. So we've observed this kind of situation, this kind of reactions among our students. And I think that is very healthy because we need to be a bit skeptical. If we are surrounding completely to the idea that the robots or the chatbot are part of our life and we somehow make our relationship with them a bit like human, which is actually something that can be that we can slide on very easily because now AI and chatbot can even initiate the conversation with you, right? So yeah, I mean some applications are just initiating the conversation and they're
Maybe
talking to you.
replica could be one of them. I'm not sure.
Exactly, we will talk about that. We will talk about that because also this is something very important that we need to pay attention to. So they can discuss things with you. They can even they have a voice. You can choose the voice they want to talk to. So that's pretty much as much as it is amazing. At some point, we need to be concerned a bit about it because it's not about us. It's about the generation to come. It's about our kids. We know now how nowadays how the kids are accessing the phones, the smartphones, the tablets. So we can only think, I mean, suppose that it will be the same with AI in the future. They will be having access to robots. Probably they will be talking to them, that will be interacting with them as if they were talking to a friend. And it's already started, as you said, while people are not
Already happening.
interacting with machine and object as object. So that, for us as psychologists, raise very important question. When we talk to a machine, you know, these machines are programmed to make the person feel good, are programmed to support you, are programmed. So basically all about helping you secreting dopamine in your brain, all about secreting serotonin, which is something good and very interesting in terms of healing. However, it's not human authentic. Why? Because in human interaction and relationship, we need to get frustrated. We need to get angry. We need to get into a conflict together. Because if I don't go through that with you, how am I going to learn how to manage difficult situation? How am I going to learn how to manage my frustration in life? And life is full of frustration.
Okay,
If
so
I don't learn
basically,
how,
yeah, sorry to interrupt you. So basically, it's like a muscle, which is the, to exercise in order to be stronger in facing the challenges that are inevitable in life. And if we don't exercise that muscle, we become very lazy and very weak in the face of these challenges in life.
absolutely. Now, for example, if you look at kids that are overprotected, let's put AI aside. I'm going to give you a very simple example. Kids that are overprotected by their parent, they grow up somehow clueless. They don't know how to interact with others, and they always need to refer back to their parent to make decisions because they were never really free to do it. So if at some point we rely to machine as much as a person is supposed to rely to parents here, and the machine is here all the time, where actually parent can be absent sometimes, but a machine will be here with you all the time. So it's an over guidance. So and we are preoccupied about how free thinking the person will be. What about bringing up creative idea? What about, as I said, managing frustration? But also, what about how can I say it? Understanding limit and social rules. For example, let me give an example. Now, let's imagine we are friends, and let's imagine we're kids, okay? So you're telling me something that makes me feel angry. So if you're a robot and you're making me angry, what I will do, I'll probably throw you on the wall. I'll probably smash you.
Or say,
What will
or
happen?
say something to bother me. Yeah.
Now I'm gonna be more angry. Yeah, I'm gonna smash you. I'm gonna smash you. I'm gonna throw it. So what will happen? At some point, the robot might not function again, of course, right? But then how to fix it? The robot will be taken to technician or whatever, will be fixed, and tomorrow or probably the same day, I'll have it fixed in front of me. So what did I learn?
Nothing.
About anger, about relationship, about fixing problems, about apologizing when I do something wrong. Nothing. But when I'm dealing with a person like me, if I'm doing something wrong, I have to apologize. I need to keep discussing with you and negotiating and understanding. Also here, empathy is very important. Understanding, how did I hurt you? Because I will see that. You will tell me, you hurt me, you did this to me. You might even cry. And while seeing this as a human being, I feel like I did something terrible and then I had to fix it.
Absolutely.
So I learn also how to manage human relationship. So my fear is if we rely too much on these chatbots as kids, because everything starts at that level, at that stage, the kids won't have that kind of critical distance that we have now as adults. So they will take everything as it is and they get used to it.
Yeah. And
So what
and
kind of
also with
future?
absolutely, and also with like a social relationship, be it a friend. How can a robot feel that I'm connected to this friend? Because it doesn't have emotions, it doesn't have feelings. It's just programmed to act in a certain way, and it fakes emotions, it fakes relationships. So it's not really mutual, in my opinion. It's a one-sided relationship. But then let me ask you a question about some of these phenomena that we see online. So for instance, the other day, I read a news item on the National that a lady got married to a chatbot. And that chatbot is embodied. It has a face, and her history shows that she was abused. She had a troubled relationship with her former husband, and then she got married to that, male chatbot or whatever. And she's saying that she's happy. I mean, as a psychologist, how do you read this?
We have a lot of phenomenon that are, closer to a disorder here, because what we're talking about is definitely here some sort of a disorder. This is not normal because an adult person should understand what a machine is, and should understand that a machine is not able to replace a human being, even if she might consider that humans are more threatening and more harming than a machine. I do understand that. Probably she went through very traumatic situations with a human, and therefore she decided to isolate herself and to be in some sort of a
protected
to
environment.
not relationship, but to only talk to and disclose with the machine, because she probably thought at a certain level that a machine is much more trustworthy than a human being. I might understand this, but reaching the level to get married and to call it in that
Absolutely.
way, I mean, that's a bit too much.
Okay.
And I even see that in Instagram there is a chatbot, I think, or a robot that was created that created some sort of a page. And that bot was a lady, a Moroccan lady. She has a name, she has everything. And she even went through some sort of a beauty contest and she won it. And I mean, sometimes when you look at that, it's like, okay, so I think somehow the fears that I have are not totally unbased. Yes, it is there. So if today, as adults, we look at that and we can criticize it, I want us to have a bit of a forward thinking and imagine how the future will be. What kind of life our kids will be, our kids and the kids of our kids will be exposed to.
Absolutely.
So this is why we need to be very cautious and very careful. Otherwise, it's going to be
I
really
think
extreme and out of hand.
researchers like yourself need to take on topics like that so that these topics
Absolutely.
become known and discussed in the society. I want to challenge you a little bit on the mental health chatbots. So the chatbots like Replica, those ones that could be friends or even partners with humans, those are called social chatbots. But mental health chatbots, they can act as therapists. Now, what you mentioned is that they lack human authenticity. But I could challenge you on that and say, hey, but they were trained on thousands or maybe millions of records of therapy between humans. So how are they not human? They are human because they learned so much from human to the point that they are better than an average therapist. What would you say to that?
Okay, so first of all, as I told you, these mental health chatbots are efficient and have proven efficient when it comes to diagnosing, when it comes to following up with certain specific disorders, as I said, such as depression, anxiety, sorry, chronic disorder, probably a bit of a sleep disorders, self-esteem issues. So yes, they can definitely manage these aspects. Because it doesn't require that much therapeutical skills. Of course, it depends on each and every situation. Here we're talking on average, right? But the idea is that we don't have any idea about on the long-term effects. Okay, you know that, oh, I got to that chatbot, I spoke, I had some feedback, I'm feeling better. No, is it something that would stay on time or not? This is something that we don't know yet. The second aspect that is very important, as a psychotherapist, whenever I engage with my patient, there is one component that is essential. In psychodynamic or psychoanalysis, which is my approach, we call it transference. In other also psychotherapy, it is there, but it's not called in that way. It's called in different ways. But let me tell you what is transference. Transference is the need of the patient to project on you some of the images of probably parent or person in his life that were either, let's say, harming at a certain level, or they were absent in his life, so that he would replay or reenact with you the trauma.
Oh God.
So in order for him to be able to do that, you need to be a human.
Yes.
He needs to see, for
think
example,
like a human, feel like a human. Exactly. Yeah.
Exactly. That kind of human touch, human interaction is very important. And as therapists, I'm going to tell you something probably that many people do not think about. As therapists, we might be very much frustrating sometimes. We are not there.
And you have to be. You have to be because you need to
Yes,
challenge
yes,
the
exactly.
thoughts of your patient, the negative thoughts.
Even unconsciously, Muhammad, because we always say in psychodynamic that the therapy is the encounter of two subjectivity. My subjectivity and your subjectivity. So we're meeting together. So of course there will be rules and there will be a frame and a code of ethics that I'm following as a psychologist. And this is the thing that I can control. But there are many other things that are out of my control that you will sense and that will help you healing unconsciously on another level that we can talk about later on. For example, let me give you an idea. For example, and this is something that happened a lot when it comes to transference, I told you, and counter transference. So what is counter transference is what I feel as a therapist from my encounter with you. So it happened, for example, that I am, for example, in my office waiting for the patient to come, and I'm sitting, I'm like, oh my God, I hope he wouldn't come. I hope he wouldn't come. Some people would say, why do I have this kind of idea? Oh, probably I'm lazy. I don't want to work today, blah, blah, blah. But if you go deeper and try to analyze it, there's always a reason behind it. And the reason behind it is all the time link it to the story of the patient. For example, I remember one psychoanalyst one day that he said he was in the session with the client and out of nothing, he starts yawning. Oh, so wow. That was super embarrassing. I mean, he couldn't stop himself from doing that. And that was super embarrassing. And he was like, oh my God, what am I doing this? I need to stop it. And he wasn't like tired or lazy or whatever. It was like some sort of a reaction that he couldn't control. And then he looked at the patient and he said, I'm so sorry. I don't know what is happening to me. And the patient's like, no, I understand. I think that somehow what I'm going through reminds you of the baby, because he was talking about some sort of an issue with his mother. And he was talking about the fact of feeling as if really low, how can I say, dependent of his mother. And he was talking about his story with his mother. Okay. So when the psychoanalyst starts yawning, he's like, oh, so you are actually showing me in some sort of an unconscious way about my story with my mom when I used to sleep, and that kind of a cognitive sleeping that I was going through because I wasn't analyzing. I was totally fusional to my mom. I wasn't able to be myself. So such a just small, I mean, non-verbal reaction.
Absolutely. Yeah.
Definitely change the game for the therapy, 100%. Which is something that would never happen with a machine.
Yes, because the machine will give you. As of now. Yeah.
Exact. I mean, I hope not. Yeah. But again, I mean, this is very important because again, it's a subjectivity. And I remember you mentioned research that we've conducted together. And I remember one of the answer of a person when it comes to relationship with chatbot, the person said, it doesn't have a soul. I don't like it because it doesn't have a soul. Exactly. So I think also it's one of the basic needs of a human being. You know, I'm Tunisian. So I'm all the time referring to Ibn Khaldun. Ibn Khaldun is a very famous sociologist. Ibn Khaldun said, I'm going to say it in Arabic and then translate it. الإنسان مدني بالطبع. What does that mean? Which means that we are social being by nature. Humans are social being by nature. What does that mean? If I don't have love, affection, interaction with a parental figure or caregivers, I won't be able to grow. I won't be able to develop. And that was proven in many research. Yes. I mean, for example, a research that was conducted by Renee Spitz about the hospitalism syndrome has showed that kids that do not have that kind of love and affection and human contacts ended up, and they were babies, huh? I mean, you could probably, the people listening to us could probably also look on the internet, hospitalism syndrome, Renee Spitz. It has been shown that these babies were like 6-month babies or something like that, and they were orphans because it was a war context. Yeah, of course. And they ended up, because they didn't have that kind of care, they ended up somehow suiciding. They stopped eating, they stopped interacting, and many of them died. Right? Even though the nurses were putting the milk into their mouth, they were vomiting it.
Of course.
They refused to live if they didn't have that kind of care. So I think this is essential for a human being to always have that kind of a human interaction. And I don't think that, at least I don't want to imagine that one day you will be deprived from it. Wonderful. I think that it's exactly like air. We need it to live.
Excellent. All right, so we're almost at the end of our episode. I want to end on two things. So your advice to psychology aspired people who want to become psychologists? Should they take on this exciting field of the intersection between AI and psychology? And then to the general public, because mental health and psychology is important for everyone. Should they leverage these AI tools, or should they wait a little bit until they become more mature?
So my advice is that we should never stop doing research. We should never stop asking questions, and do not be closed mind. Be always open mind. I mean, okay, this is something new. This is a new phenomenon, but it's also part of a reality. So I don't think that at some point we will be able to stop it, right? So we need to understand how it's function. We need to understand what are the benefits, and we need to understand what are the disadvantages, and we need to be able to control these. So if we stop doing any research about it, it's exactly as if we're denying reality. And that's definitely not what I'm
That's a
asking
hot field that
psychologists.
we should get into it and see to what extent
Exactly.
it can be beneficial and to what extent it can be detrimental to our society. Wonderful.
Because nothing is pure. Nothing is pure by itself. It depends on how we use it, right?
Is that
And
true?
my advice to people is, before engaging in those specific tools, make sure that you read a bit about it. Make sure that you might ask some specialist about it. It's totally fine to use it for emotional support, but also many people were questioning the idea of privacy, the idea of information leakage. I mean, to which, who is behind that specific chatbot? So there are some privacy issues or privacy concern. So also people have to put in mind, whoever is using chatbot, they have to put in mind that at some point these information might be used. Of course, I mean, the websites on the chatbot creator are granting 100% that's not happening, but they cannot grant it at 100% because we know that it's technical, it's on the website, so we don't know what's going to happen with those. So we need to be alert, we need to be aware, and it's fine. We can use it, we can try it, and if it's helping us at some point to feel a bit less lonely and to provide us some sort of a guidance, then why not? But be balanced, please.
100%. Wonderful. Well, that was a great episode. I enjoyed it a lot. Thank you so much, Dr. Jihene, for being my guest today. Thank you so much.
Thank you. It was a pleasure having that conversation with you today, and I hope that the people that are listening to us are understood the concept a bit more and get some advantage out of that.
Absolutely.
Thank you.
Thank you so much.